AB 2233, Medi-Cal Assisted Living Waiver Program. Thank you. Welcome.
Thank you very much, Mr. Chair and Senators. AB 2233 would increase the number of slots available under the Assisted Living Waiver Program to 18,500, expand geographic representation of the program on a regional basis, outline requirements for the stakeholder process, and address various programmatic elements that impact its current effectiveness. The Assisted Living Waiver Program takes seniors from nursing homes who don't need that level of care and places them in an assisted living facility or provides services to seniors so they can remain at home. In both cases, by avoiding the high cost of nursing home care, especially since that level of care is unnecessary in many cases, it provides a dramatic cost savings to the state. Furthermore, it frees up valuable nursing home beds for those who truly need them, a win-win for everyone. Currently, the demand for Assisted Living Waiver Program has outpaced supply and operates with a significant waiting list. According to the 2017 Long-Term Services and Support Scorecard, almost 11% of California's 101,000 nursing home residents, or close to 11,000 individuals, are identified as having low care needs. By expanding the Assisted Living Waiver Program, we could place those 11,000 individuals in the most appropriate setting they belong, where they are best cared for and where they would be the happiest and have the best health outcomes. This could all be done at a significant savings to the state. I accept the committee amendments to clarify financial eligibility standards and appreciate the work of the committee and staff. I have with me today George Kutnerian of 6 Beds and Eric Carlson with Justice and Aging to offer testimony and help answer any questions you may have. I respectfully ask for an aye vote.
Okay, thank you. Welcome.
Thank you, Mr. Chair, members. Good afternoon. My name is George Kutnerian. I'm here representing 6 Beds, which is a statewide trade association that represents over 2,000 residential care facilities for the elderly and adult residential facilities serving 6 or fewer persons. 6-bed facilities play a vital role in the Assisted Living Waiver Program, representing approximately 50% of the ALW provider base. I also would like to start out by thanking Assemblymember Kalra for introducing this bill and for championing improvement of the ALW. This is a program that has vast untapped potential, and this bill takes critical steps towards helping meet that potential, particularly in a couple of areas. First, increasing the capacity of the program to 18,500 slots in conjunction with geographic expansion really represents a major step towards greater access and timelier access to the program. It's currently estimated there are 3,500 persons on the wait list, and because the ALW has a application process that is separate from regular Medi-Cal, even if you add enough slots to absorb the current wait list, we would still estimate that it would take DHCS upwards of 2 years or maybe even more to process everyone on the wait list. So every time we get into these long wait list situations, DHCS finds itself having to dig itself out of a hole. And the big losers in these scenarios are the Medi-Cal beneficiaries. They're the losers in these situations, and basically long waitlist situations in any home and community-based services program is problematic, but it's especially problematic for programs that primarily serve older adults, where remaining life expectancy is a real concern. The average ALW participant has an average length of stay of a little over 8 months. So if it's going to take over potentially 2 years or more to process everyone, and you have an average length of stay of 8 months, I can tell you pretty confidently that there's going to be a number of people on the wait list that aren't going to survive the wait. And I would respectfully submit to the committee that that's just an unacceptable outcome. Certainly we can do better, and this bill will do better, and namely by keeping the ALW ahead of the demand curve instead of lagging behind the demand curve. A long wait list is also problematic for provider participation. Anytime the ALW comes to a grinding halt for any extended period of time, it has a chilling effect on provider participation. New providers don't want to come in. Existing providers may discontinue their participation or at least scale back their participation. And so trust in the program among the provider community is eroding, but by passing this bill, we can help restore that trust. And finally, provider participation is impacted by reimbursement rates. Except for the most recent minimum wage increases tied to SB 3, the provider rates have really stayed frozen since the inception of the program in 2006, when minimum wage was $6.75 an hour. So basically, for a decade, there have been stagnation of the rates. And if the ALW rates rates don't remain competitive, ALW providers are going to increasingly favor private pay clients over ALW clients. So in closing, increasing the ALW's capacity, expanding its geographic reach, and increasing the provider rates will contribute to a more robust provider ecosystem with an increase in both the breadth and depth of provider participation. Importantly, a more robust provider ecosystem translates directly to greater access and consumer choice for Medi-Cal beneficiaries. We respectfully ask for your aye votes. Thank you.
Thank you. Welcome.
Thank you. My name is Eric Carlson. I'm with Justice in Aging. We're a nonprofit representing the interests of low-income older folks, and I want to speak for them here today to point out what an important option this is or could be for people who are no longer able to live at home, who have limited financial resources, and who practically oftentimes aren't able to find an alternative other than a nursing facility, given the way that the system is currently set up. This bill would go, if enacted into law, would go a long way towards improving the situation by increasing the size, as has been mentioned. The current size of the waiver is about 3,500 people, and by any measure, it's just a fraction of the need that's out there. If you think of the population of California, 100,000 people in nursing facilities, and all the rest, it improves the transparency of the process. Mr. Kutnerian described the wait list that currently a consumer, as a practical matter, has no ability to know where he or she may be on the wait list at any one time. It's a black box. It's a mystery to people. And one of the important things that this legislation would do would require communication, require transparency, allow all participants in the program to better understand where people are at any one time. And it would also improve the program to increase the availability based on the financial eligibility standards, so that some people who currently are forced into nursing facilities would have options. As a practical matter, single individuals right now who have monthly incomes of $1,500, $1,700, $2,200 a month are easily able to receive Medi-Cal reimbursement for stay in a nursing facility, but not in an assisted living waiver. And that's an improper incentive, and it's something that this legislation would go a long way to clear up. So it's an important program. It's underutilized. It's technically available, but not practically available, and we respectfully request your aye vote.
Thank you. Other witnesses in support?
Carol Sewell from the California Commission on Aging. We strongly support this economical and affordable alternative to nursing home care.
Okay. Thank you.
Rebecca Gonzalez, National Association of Social Workers, California, chapter in support.
Thank you.
Ann Coney. I'm a constituent of Dr. Pan, and I'm here as an advocate for the Alzheimer's Association. We strongly support the bill.
Thank you.
Deb Roth, Disability Rights California, strong support.
Thank you.
Jim Gross on behalf of the County of San Diego in support.
Thank you.
Shubhangi Demokos with UDW AFSCME Local 3930 in strong support.
Thank
you. Linda Way with Western Center on Law and Poverty in support.
Thank you.
Kelly Brooks on behalf of the County Welfare Directors Association and the Ventura County Board of Supervisors here in support.
Thank you.
Jacqueline Ennis with AARP with strongly support.
Thank you. All right. Any witnesses in opposition? Okay. Seeing none. Questions from committee members? No. And then there's a motion for Senator Bell. Thank you for addressing this issue. We do need to build our capacity. Would you like to close?
I'd like to ask for an aye vote. Thank you, sir.
Okay. Thank you. So the motion is do pass with amendments, which you are taking to appropriations. It's been moved by Senator Bell. Secretary, please call the roll.
Pan?
Aye.
Pan, aye. Wynn? Bell? Bell, aye. Hernandez? Aye. Hernandez, aye. Leyva? Mitchell? Aye. Mitchell, aye. Monning? Nielsen? Aye. Nielsen, aye. Roth?
Okay. Okay, the bill has 5 votes right now. We'll put the bill on call. Thank you. Okay, so next bill is item number 19, AB 2963.